Alright, this is my IV infusion video, and so I'm going to start off by stating the 6 rights of the patient. So right patient, right medication, right drug, right dose, right route, right time. And so I'll start by using my, with hand hygiene, and then I'll verify the doctor's orders for what he wants me to do, which would be starting an IV and then starting an infusion. And so what I'll do is I'll go to the med room, and I'm going to do this before I go to the patient's room. I'm going to check the solution that I have, which is the 0.9 NS, and then I'll also get my catheter ready that I'm going to do to place the IV, a saline lock, some saline, and a label. And I'll now open my solution, and I'm going to check the date of the solution, make sure it's not expired. I'm going to check it for color, make sure there's no discoloration, it's not cloudy, there's no particulates in it. Okay, and then I will label this. I don't have a label, but I will label this with the patient's name, date, my initials, the rate that the infusion is going to be at, which would be 168 mils per hour. And then I'll put the time that it's going to start, and that's going to be at 0800, and it'll end at 1400. And then I'll also get my tubing here, and I'll open my tubing, make sure that my tubing has no kinks, it's no tears in it. And that has a drip factor of 10, and so that'll affect my drip rate to be 28 drops per minute, and that'll be about 7 every 15 seconds. So I'm going to open this up, if I can get this untangled. There we go. Alright, and with this, I'm going to use a septic technique and make sure that I don't contaminate it to spike the bag. There we go. And after this, I'm going to make sure my clamp is closed. Alright. Okay. I'm going to fill it half full. And then I would get this and my supplies, take it to the patient's room. Alright, knock knock. Hi, I'm Leslie. I'm going to be your nurse, and I'll identify myself to the patient. Can I get you to verify your name and date of birth? And is IV needed? Yeah, and he has an allergy to penicillin and latex. And so I will use my hand hygiene, and I'll verify again the 6 rates. And that will be the right patient, right medication, right dose, right route, right time. Yeah, and then documentation afterwards. And so I would explain to him that we have orders to start an IV and an infusion. And so what I'll do next is I'm going to get ready to start an IV. I'll apply my tourniquet, and I'll make sure he has a drip pad underneath and that he's in a comfortable position in bed. Alright, and so I already did my hand hygiene. I'm going to get some gloves on. And then I'm going to feel for a radial pulse after the tourniquet's on. Make sure that he has one. If he doesn't, I'll reapply the tourniquet with less pressure. He does have a radial pulse. And I will try to locate the vein that I'm going to insert the IV in and make sure that it rebounds. Alright, and it's rebounding. And so I will loosen my tourniquet, and I'm going to get my supplies ready to start my IV. So again, hand hygiene. I'm going to get my 20 gauge catheter ready. And then with my tubing, I gotta make sure that I label it. So I'm actually, before I hang this, I'm gonna label it with the date and time of when I put it on there. Sorry about that. There. And I already wrote on it. Alright, and so again, I'm gonna have gloves. He does have an allergy, so I'm gonna wear non-latex gloves. And yeah, so I'm gonna get my swab here, and again, reapply the tourniquet. Ensure that he's comfortable still. Alright, and so again with gloves on, I'm going to clean my site. Now work position. And then re-clean it again. And then let that dry. And so I located my IV site, it's dry. And then using this, I'm going to take it out, make sure that my catheter is intact. There's no tears or kinks or anything. Again, so, and I'm going to pull back with my non-dominant hand to stabilize it. Bevel up, and I'm going to insert it. And then once I have flashback, I'm going to release the tourniquet, and I'm going to insert it without the catheter in there. There we go. We'll lock it. So what I'm going to do is I'm going to stabilize it with my other hand, withdraw the catheter, and then I have my saline lock ready.